Speaker today, Joan Seidel, is here as the Kent City Health Commissioner. I had the pleasure of her chatting with our organization several months ago, and it was really wonderful. I encourage all of you to chat with her. She's going to leave some time for Q&A, certainly a very relevant time, talking about COVID. And the state of the pandemic. Joan has been a registered nurse for over 30 years and currently as the Kent City Health Commissioner. We're excited and thank you so much, Joan.
Okay, thank you. It's so lovely to be here. It's so nice to be invited back. So I'm glad that the first presentation went all right, that you're interested to hear what I might have to say now. So I do have 3 objectives. If we could move to the next slide, please. I wanted to talk a little bit about influenza, which we know is distinctly different from SARS-CoV-2, but it's a nice thing to look at in terms of getting some background. And then also to review the current status of the pandemic in terms of COVID-19 and its variants, and then finally look at some mitigation strategies or safety strategies that we might want to continue to employ as we move on. So the next slide, please. So what we're going to do is talk a little bit about influenza. Are you able to advance? Oh, that's too far. There we go. Okay, so there's 3 different strains of influenza, A, B, and C. We don't really care about C because it doesn't infect humans, but we do care about A's and B's. And so because of those 2 strains, and then this illustration that's there is of the influenza virus. The little red projections are hematagglutinin, and there's 18 of those, and then there's 11 neuraminases, and those are illustrated as the blue projections. And the reason that we care about those is that based on how those are configured, we not only get the nomenclature, so for like H1N1 or H7N9, those are different strains of influenza, and so that tells the scientists how easily it is transmitted and then how sick it might be able to make you. So, and if anybody's ever heard of Tamiflu, that's a neuraminidase inhibitor that keeps you from getting as sick. It does not cure flu, but it helps kind of knock down the symptoms so that you start feeling better a little bit faster. Now, influenza is similar to SARS-CoV-2 in that it's also an RNA virus. And what that means is that it's not alive. It can't reproduce on its own. It needs a living host, just like SARS-CoV-2 needs a living host to replicate. And so it gets inside your cell. It's not very clean at replicating off of our DNA, and changes occur. And so that's why I have the picture of an iceberg. If there's a slow change, like say during the course of a flu season or over the year, you know, unless you're the captain of the Titanic and you see that iceberg is moving farther south and melting, if you see an iceberg, you know that that's danger. In the same way, when there's antigenic drift with influenza, then your body can still recognize it to a certain degree and mount a defense to protect you against it. So you might get some symptoms, but possibly not as ill. However, when there's an antigenic shift, when it happens suddenly and very rapidly, your body has no protection, no immunity, and it can't fight it off. And so you may become very ill. When antigenic shift happens on an A strain of influenza, we often get pandemic. So that just gives you a little background on that. So we'll go to the next slide then and talk briefly about the RNA virus of SARS-CoV-2. I won't go through all of these, but just to tell you that when you get infected in inoculation with SARS-CoV-2, it's going to have one of those corona-like spikes are going to insert into a receptor in your cell. It's going to come inside your cell. And again, it can't reproduce on its own. It needs our DNA. So it's going to enter your nucleus. It's going to more or less spill its guts. And its RNA is going to line up with our DNA and start making copies and start replicating. And then once it's done that, it will release them so that it can infect more cells in our body. Again, this is an RNA virus. It doesn't replicate very I think well, it's sloppy. And so the way I like to liken it is to a zipper. And after you use a zipper a number of times, sometimes it gets stuck, it doesn't line up quite right. And so changes can occur, mutations or variants can happen with SARS-CoV-2. And that's what we're seeing right now, as we're seeing that these mutations have arisen. So let's look at the next slide and we'll talk a little bit more about the variants. There's 3 different kinds from the CDC, and they kind of go in descent or in order from the lowest level of concern, which is still of interest. And there's 7 current of those variants. There's 4 of concern. And then currently, thankfully, there's none of high consequence. But all of these levels look at how readily it's transmissible, how easily it is to be detected. And then also it looks at how effective are our current treatment strategies against the virus. So we don't want any variants of high concern, but we know as long as the virus is out there and able to spread, it will continue to mutate. Even though it's not a living organism, it wants to survive. It can only survive through living hosts. And in terms of the variants, we know that the novel SARS-CoV-2 virus was very effective at spreading, right? But the Alpha variant that came from Britain, it was 50% more effective and quickly took over as the leading variant or the leading strain around the world, and certainly in the United States. Right now, Delta is the concern, and it is 60, I think I said 51 to 67% more readily transmissible than the Alpha was. So back when in March of last year, when we spoke about the R0, about how easily it was to spread, one sick person might infect 1 to 2 other individuals. With the Delta variant, one sick individual can affect up to 8 or 9. So that shows you that it's quickly becoming a very deep concern, not so much for those individuals who are vaccinated, because they have a really decent protection level. There's still a good match with the vaccines that we have out there, but it's really truly a concern for those people who are not vaccinated. And perhaps you've heard Dr. Fauci or maybe even Dr. Vanderhoff from the Ohio Department of Health say, it's not if for people who are unvaccinated, it's when you will get Delta. It is that easily transmissible. So that changes, I think that changes things. Maybe you've heard both of these physicians speak about how we have 2 separate Americas, how we have 2 separate Ohios based on who's vaccinated and who is not. And we're seeing that the younger people, the 20 to 50-year-olds are getting sicker. They're getting sicker quicker and ending up in intensive care units as well. So I heard the physician, I can't remember his name, from Wexner Medical Center at the Ohio State University say, although it's not incredibly high numbers, their cases have doubled in just 2 weeks in terms of who's being admitted. So this is a concern, because the more people who get sick, the more can get more seriously ill, and of course could even die. So I think I have one more slide that looks at the variants and how they've changed and overtaken. So starting back in April 24, you can see the one that we're most concerned with is right now is the Delta variant, which is the deeper orange. And you can see how it started out as a very thin line. And then as of July 17th, you can see how it's really expanded and overtaken. So definitely spreading rapidly. The next slide, I'll just quickly show, is that it's an inverse relationship. The more that you have people vaccinated, the less deaths. The less you have people vaccinated, the more deaths. So this is currently what we're seeing in the United States right now. So again, this is a time of concern. So the next slide, I would say that within our marathon, we now have a sprint. Delta variant is outstripping and outrunning us, and we are trying desperately to catch up to it. And the only way we can do that really most effectively is through vaccines. So the best time to have been vaccinated is by June of 2021. The next best time to be vaccinated is starting today. So next slide, please. And this is just a thought to consider that viruses only mutate if they keep infecting. So we have to stop them from infecting. And the best way to do that, again, is through vaccine. Next slide. All right, so we also have some legislation that's impacting our ability to robustly handle pandemic in a way that keeps our communities safe. There's a bill 244 that states that you cannot discriminate between people who have been vaccinated and those who have not, so that you can't exclude them from programming, from schools. And really, if you're vaccinated, you have that protection, that's great, but there's still chance for spread amongst unvaccinated people. And we know with this Delta variant that a smaller inoculation makes people sicker. It replicates more quickly within your body and makes you more ill. So I have concerns for that. Another bill 248 says that you cannot mandate vaccines that are not fully FDA approved. I don't know if you're aware, there's at least 4 colleges and universities in the state of Ohio that have already mandated students and faculty must be fully vaccinated before they return to campus. I'm not sure how if this bill passes, how that will affect that mandate. And there are more organizations that are now requiring for their employees to be fully vaccinated. I know that in terms of this, we might have some positive impact in that Pfizer has already applied to the FDA for full approval, but their appointment is not until January of 2022. So that leaves a large window. There's a large gap there. And we know that many people step forward and get vaccine, but not enough to make the difference that we need. And then the most recent one, Bill 209, it looks at banning mandates at any type of school area. So that's a concern because we also know that we have a good section of our population, especially in the school age children, they're not even eligible for vaccine. So that creates a space for spreading too. And although we, in the past have said, younger kids don't get as readily affected, they don't get as ill. It's just like kind of in comparison to how sick older adults, more mature adults got. But that doesn't mean that children went without getting seriously ill. We've all heard of that multi-inflammatory disease that many children can get after this. So they can get gravely ill and die as well. So this is a concern. So now in pandemic, I feel like we have a demolition derby during a sprint, during a marathon. I mean, it's just that complex. So what can we do in terms of strategies for ongoing safety needs? If we can have the next slide. First, if you have not already, please get vaccinated. I was very happy to hear that many of you, or if not 100% of you already are. So good, and thank you. The second thing is if you are vaccinated, speak to your friends, speak to your family members, make sure that they are going to get their vaccine if they have not already. You see in the middle picture, that's myself vaccinating George Joseph. He waited patiently for his turn, but when it was his turn, he rolled up his sleeve and he took his shot. He was a great role model. So we want to make sure that we are encouraging those people, that we know might not have had taken vaccine to do so. And there's studies out there that show even on top of our primary care physicians who we know and trust, our friends and family members, we trust them. So if you tell your friends and family members, hey, I took the vaccine and I did okay, I'm sure you will too. That goes a lot farther than someone like me telling people to get vaccine because they're not quite sure who I am and why, if I have another agenda, which is keeping people safe and healthy. But so we want to definitely do this. So the next slide looks at a little bit more in terms of how do we know people's vaccine status? Because that's important to all of us, that they talked about when we first had the novel virus back last year, that we would maybe need 75% people vaccinated to get herd immunity so that it would stop the spread. With the Delta variant being so prolific, they're now saying 95% of people have to be vaccinated. So that bar just rose quite a bit. So if you ask people, I think first of all, many people who've been vaccinated will offer it up willingly. If you ask somebody and they kind of hesitate, what I would say is you don't have to browbeat them. It's not a thing about shame or trying to punish people. But if they don't offer up, yes, I am fully vaccinated, then treat that encounter as if they're not vaccinated and try to limit it if it's indoors, not have too big of an event, try to do your visiting outside because we know that that's a little less risky. Is it a HIPAA violation for somebody to ask about another person's vaccine status? It is not, unless you come to me and say, oh, Joan, can you tell me if so-and-so is vaccinated? Then I can't share that with you. But if you want to ask me if I'm vaccinated, sure. And actually, Mr. Khan did that in a very nice way. So if you need to know how to ask somebody about their vaccine status, he could certainly give you some very kind tips. The next slide. So we have some personal responsibility and some shared responsibility in terms of our strategies for ongoing safety. So certainly, we want to continue to think about physically distancing. We want to continue good hand hygiene. We want to make sure that we have masks handy in case we need them. Those of us who are fully vaccinated really don't need to wear masks, but there may be situations when Delta comes on at a fuller force because the vaccine is not 100% effective. There are some breakthrough cases. So there may be a time when we need to have those masks pulled back out, even if we're fully vaccinated. And certainly if you're in a crowded area, try to limit your time. And again, contact tracing and case investigation, the health department is still doing that. Shared responsibilities include screening. So if you should still be screening people at work in terms of, are they having symptoms? And if so, send them home and ask them to get tested. And then also, quarantine and isolation are still going to be in effect. That's been limited a little bit in terms of some of the House bills that have been passed already. The other thing is really to look at your ventilation system. So if you notice these blue boxes on either side of the gymnasium this morning, those were our needlepoint ionization units, and those were purchased by the health department with the federal COVID funds. And they help purify the air, not only for SARS virus, but for multiple other viruses, bacteria, molds, and dust and things like that. So that helps. That's another layer of protection that we can use. So we want to make sure that we're doing things like that. And I believe that the Kent City Schools has actually done some great work with that in terms of their buildings as well. So maybe Mr. Joseph will go into that next week. Okay, next slide, please. So in terms of our layers of Swiss cheese, this is our vaccine rate. This was taken from the Ohio Hospital Association. They've been sharing their data very generously. And this shows Portage County and our vaccine rate. So in the state, our vaccine percentage is 48, almost 49%. So we're not, maybe halfway to where we need to be. Portage County overall is about 48% vaccinated. In Kent, or at least with a zip code of 44240, which also includes Brimfield, we're about 55% vaccinated. So a little bit higher than some of the other areas and higher than the state, but we're still a ways off from where we need to be. So we need to keep encouraging individuals to take vaccine. The next slide. Oops, I'm sorry. I thought that advanced. So there's our slide. You can also see that Streetsboro, which is the city above us, they're at 60% and Aurora is at 70. So some are really reaching and striving to make that mark. I think we can do at least as well as Streetsboro and Aurora. So, okay, next slide, please. Oh, we'll go forward. Okay. The other thing is that we know that pandemic really changed a lot of our activities. It halted a lot of things that we wanted to do, but now they're back at full swing. And we're so glad to be able to participate in these things. I don't know, this New Yorker cartoon caught me as interesting because of the backlog of wedding invitations that have been coming through. I know that at least that's true with my friends and family. But Johns Hopkins University College of Public Health also published a little piece on their social media that said, hey, if you're having a wedding, you should ask on your RSVP, are you vaccinated, so that you know how to sit people. So that would make a different type of a seating chart, or maybe you would tell them not to come or only come if the reception is outside, not to come into the church. So something to think about there. And I think it's just the risk stratification of knowing what the activity is and what the risk may be. The next slide. So certainly, again, as I said earlier, outdoor activities that we know are much, much safer for us than indoor activities. But if the outdoor activity is like this concert where people are literally shoulder to shoulder, it is the same risk level as being inside. So think about that as you plan your events and as you jump back into summer, as we want and love and know it to be. Just kind of consider what's going to be my strategy, what's going to be my plan in terms of not being in the center of that crowd or being able to exit or, stay for just a brief moment in time. So next slide. The other thing is making sure that we have reliable information. There's so much misinformation, and I know everyone from President Biden through our Governor DeWine has talked about how misinformation surrounding pandemic and vaccine has really influenced and honestly maybe contributing to people dying unnecessarily because they're not taking their vaccine, that they're relying on this or wrong information instead. So, and unless you're friends with or following Dr. Fauci, I think he's a reliable person. CDC, Ohio Department of Health, those are good reputable places to get information from. And then the other thing that we started talking about way back in February of 2020 is that this is a long process. We have to be kind to ourselves. We have to take care of ourselves, but we also have to be kind to each other. We've all been going through this very long bout of agony and turmoil and a lot of frustration, and we still need to be kind to one another because we're all kind of in this together still, and we have to realize that the wear and tear of 18 months of this is going to have people a little bit frazzled. There's certainly some tensions and some differences of opinions, but we have to continue to be kind to each other, and that I think will go a long way. Our next slide. And I think that's it. I'll leave it open for questions. I just wanted to have this picture of the health department. In case you weren't aware, we did move to the Kent Central Gateway on the second floor. So that's where you can find us now. We also just signed a lease on the street level space where Cutler Realty used to be. And we want to turn that into more of a clinic where we can do some COVID testing, perhaps do some vaccines and have it easier for people to find and get to. So, all right.
That was wonderful. Do we have any questions? Any questions? Amanda, can you?
Sure. What do you project happening this fall as schools reopen and we all start to being forced back inside? Are you anticipating another spike?
Yes.
And
yes, I'm definitely anticipating another spike, and I already start to see the cases increasing. We had several weeks so far this summer where we had no new cases. Then we started seeing 1 to 2 cases a week. Just over the weekend, 13 new cases. And it's a slow growth and then it takes off. So I'm really concerned because again, we're getting back into our activities. We know some of our increased caseload is because of 4th of July. There's a 2-week lag, and then we start to see increase in cases and hospitalization. But I think a good part of it is from Delta, and we're just going to see more. We're going to see more of this Delta variant spreading. So I'm concerned for what that means for the unvaccinated people. Yeah.
Several weeks ago, there was a conversation about reducing the number of health departments. Speculating.
Yes. Thank you. Thank you for that question, because we were all walking on eggshells at our department as that was unfolding. And I did reach out to our representative, and she very kindly took up the baton for that. And so what finalized, because that was actually part of the state of Ohio budget. They put that into the budget bill. And the final wording was if a health department is serving less than 50,000 people, and you can't include college or university students, so we're at our 26,000 people, we would fit into that less than 50,000 served. That as long as you're going after public health accreditation or you're already accredited, you would not have to combine. Thankfully, we're in the last leg of our accreditation process, so we seem to be safe at this point. Thank you for asking. Well, education is always one, but we have found historically that when people are on the fence, education helps. When people are really dug in and firmly entrenched in their beliefs that vaccines don't help, that they might hurt, education actually makes them dig their heels in more. So what we are looking at doing is trying to go after those people who are on the fence and trying to get them persuaded, because a lot of people, it's not that they were hesitant, but I think they just wanted to see like what happened. And so now they're seeing, okay, my friends and family are doing all right. And then they're starting to have some concern about Delta. So hopefully we'll get those people folded in. And that's one strategy, is trying to go after those. No. Sure, I can see it. Sure, because I spoke, I know I spoke for a long time, so. Yes. Yeah. Yeah, that's a great question about, will we need a booster? And if so, when would that happen? So I think maybe some of you might have heard that Pfizer came out with a statement and said, because of their studies, they've had people enrolled and they've been vaccinated for over a year, and they're starting to see some decreasing immunity at this point through the lab work that they're doing. And so they suggested that was actually in people who are immunocompromised. So whether because of treatment or whether because of disease process, their immune system is just not as robust. They were suggesting that those individuals would benefit from getting a booster at least the year mark. Now, at the same time, the CDC and the Ohio Department of Health and FDA all said, it's too early, too early. We've got to get more needles into arms of people who haven't been fully immunized yet. So there is really no timeline to answer your question in terms of boosters, but I believe it will, because so few people have taken, I mean, only 50% of people have taken, we're going to be living with COVID for years and decades. And it's going to be similar to influenza, where you have to get your flu shot every year, and maybe you'll have to get, your COVID vaccine either every year, or every 3 years, or whatever that time frame is determined.
Thank you very much, Joan. That was fabulous. As you may know, it is our way here in Kent Rotary to have a responder to our speakers. And today our responder is Paul Organ. And after Paul, we'll stand and do the four-way test.
Well, Joan, thank you so much. I've run a couple of marathons, nothing like what you're going through, okay? This has been hard for everybody, and I can only imagine in a public health setting with the various different ways of expressing oneself about what you're doing and whether it's good or not. So thank you so much for your service. I'd also have to say that you used a lot of words, especially at the first, that I don't understand. I'm glad you do. Okay. I'm also glad that you gave us some very simple, practical things that we all ought to be doing, like get vaccinated, nicely ask others to do the same, avoid crowds and close contact, and be kind. All good things are not that hard. We can all be doing it. And I'll just say, I'm going to a conference in Denver next week, inside with people. I'm going to wear a mask. I am vaccinated. I'm going to wear a mask.
If we could stand for the four-way test, thanks so much. If you haven't signed up for lunch for next week and you're planning on being there, look for one of the sheets on the tables. And of the things we think, say, and do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Thanks so much for being here.